How many people do you meet every day? How many people do you have contact with? Fewer than before, certainly, but still perhaps more than you'd think. Do you remember all of them? Would you be able to remember all of yesterday's? Or last Thursday's? Or would you be able to tell someone else? Would you be willing to do so? Coronavirus has had themes, and the next one will be contact tracing. The idea is very, very simple. Anyone who has been infected is contacted and asked who they've had contact with. They in turn are contacted and put into isolation. Because so many people who have this illness are asymptomatic, most experts now agree that if we're to have any hope of living with it, any hope of easing the lockdown, that this process will be crucial. The countries which have most successfully kept death rates low, like South Korea, have gone to town on contact tracing and isolating patients. Last week, the government announced an expansion of our own programme.
We need to be really kick-starting contact tracing as the new number of cases begins to fall. We're preparing for this now by hiring an initial 18,000 people.
Scientists call this R.
The hope is that 18,000 new contact tracers can help push the R rate, the reproduction rate of the disease, down yet further. But Public Health England's current capacity of tracers is 290. It'll be a big challenge to scale up quickly, with three principal challenges. The first is numbers of contact tracers. The town of Vo in Italy kept its outbreak better controlled than neighbouring towns and cities through extensive use of contact tracing and quarantine. The man who helped set it up says that 18,000 isn't nearly enough.
No, I think this is a drop in the ocean. I think at this point of the epidemics, they are not enough. Probably they will play a major role when transmission is slowed down by the effect of the lockdown. I mean, then maybe at that point, I don't know what kind of model they've used to reach that number.
Building the infrastructure is itself a Herculean task, more challenging, former Health Secretary Jeremy Hunt has said, than even the Nightingale Hospital programme. Some of England's contact tracing capacity has been hollowed out in recent years. One area which still does have significant tracing expertise is sexual health services. We've been told that sexual health clinics have been contacted by Public Health England to assist creating and manning the new system. Not anyone can do it. You need proper training and probably a medical background. And there's another, potentially more human problem too.
Despite the fact that this is a huge endeavour and there are thousands and thousands of people that will need to be contacted, I think it still has to have that personal touch. People that we're contacting need to feel that we are hearing their situation. They need to feel reassured that if they tell us the truth, they're not going to get into trouble. That if they tell us, okay, so I wasn't socially isolating, I have been out, I have been to a party, I did go and meet up my family and I shouldn't have done, I did have sex with somebody, they need to feel that if we hear that, we can listen to it and we can help them do something about it. And you need to be able to get people to do that so that you can get the contact tracing done.
The government hopes that an app which we all carry can do the heavy lifting, but the tech is uncertain, and where it's been tried, like Singapore, take-up rates low. Where contact tracing might be really effective is helping manage localised outbreaks. An untold story of our crisis so far is how different this outbreak is in different places in the UK. Newsnight has seen local authority data which shows the extent of the virus in different places. Sheffield, for example, is especially severe. But if local areas aren't freed to exercise control over this process, we might find that contact tracing suffers, as did testing, from too much power being hoarded at the centre.
One of the problems is the government has chosen to treat this as a national epidemic using a top-down centralised approach, because what you've got is hundreds, if not thousands, of small outbreaks that are going on at local level, and the only way you can get on top of those outbreaks is by careful monitoring and surveillance on the ground and involving your local community and understanding your local community. And in some areas, we're going to need many more contact tracers, and some areas we will need far fewer. So it will really be down to the local areas to decide how much they need, what they need in relation to the number of cases that they have.
The government may yet hit its testing target or come close. That's no mean achievement. But testing is only a means to an end, and contact tracing is one of those ends. Until a vaccine comes, if it doesn't, it might be the only card we have to play.